We're live.
Good morning, everyone. How's everybody doing?
Fabulous.
I love Selena. It just wakes me up. It just brings my bright eyes. Just wake up and say, Ruth, jump. We are glad to have you all back again. We have full house today. Hey, everyone.
Good morning.
Good morning, everyone. Welcome to Coffee and Dulce. And actually, I believe we may have a person who's coming on here right now. So we're going to go ahead and let him in as well. He's just a little bit late. He was the person during our pre-meeting here that we were talking about. Give me 1 second, y'all. But I want to welcome everyone to Coffee and Dulce. I'm Christian Cano. I want to thank everyone who's joining us on Facebook Live, but also everyone who's joining us on YouTube later and also on Facebook as well. We are here. I am here to tell you where I have been on vacation for the last almost 2 weeks. I can finally say it because I wanted to make sure we did everything as safe as possible. I also wanted to make sure that the city that we were in was practicing some of the safest measures in the United States. I'm in the Caribbean island of Key West, Florida. So anyone who knows Florida, Key West, they actually believe they're their own island. They're the Conch Republic. And we have been here in safety with the iguanas as well. So I want to thank everyone for who is here in Key West, who's made us feel as hospitable as possible. But also I want to share with you the measures that they have been doing that are far beyond, I think, any other city that I have ever been to or I've been to. So we're going to do as we always do on Coffee and Dulce. We're going to go around the Brady Bunch screen. Please share with us who you are. And if you have an imaginary button, go ahead. So we will start. Who wants to start?
Hey, Steve goes first, then Dr. B, then Jenny, Barbara, me, and Emmanuel.
Okay. All right. So Steve, take it away.
All right. My name is Stephen DiFiore. I'm a Charlotte resident, a North Carolina resident, your resident libertarian for today, and a gubernatorial candidate in the 2020 election. You can visit my website, stevefornorthcarolina.com.
Who's next?
You're muted, Dr. B.
Okay. Thank you. I'm George Bohmfalk, a retired physician, Medicare for All supporter here in Charlotte. And I just want to put a little plug that it's becoming pretty evident that if we had had Medicare for All when this thing started, we would have had everybody able to get their testing and health care, and we would have had a more coordinated response kind of nationwide, and we would probably have half as many deaths as we do now. So just keep that in mind when you talk about, oh, Medicare for All is socialized medicine and we can't afford it. Half as many deaths as we would have now. So just a word.
Hi, I'm Jenny-Jaymes Gunn. I represent Charlotte Pride and the National Organization of Women in Charlotte. I'm also a proponent of Medicare for All. I don't even think there's even a question anymore whether we need it or not. And gun sense laws, Moms Demand Action. And virtual Charlotte Pride begins this weekend. So we're doing everything virtual this year. But we do begin Sunday with the interfaith service and several other activities, including a virtual scavenger hunt. So it's going to be a lot of fun. Stay tuned.
Am I next?
Yeah.
I'm Barb Bacon. I'm a healthcare advocate here in South Florida, and I'm also a part-time construction worker this week. So I'm happy though. It's going to get done.
Good morning, everyone. As y'all know, I'm a co-host here for Coffee and Dulce. I am always glad to be here every single Wednesday at 10 a.m. My name is Ruth Perez. I'm a community advocate for North Carolina now, because I figure I'm going to be going to Washington. So I do support everything that everyone has said, except that I'm an unaffiliated party. So I might have some little bumps with y'all sometimes. But I do support Medicare for All. We definitely need that. And like I've been telling y'all, we need a gun sense reform. We definitely need to do something about RNA, what they're doing. You know, we can't allow our kids to be killing and having so many deaths every single day. So that's about it for right now. Next.
Hello, I'm Emmanuel. I'm with the UID organization. I'm 21, and yeah. The UID organization is an organization started by me and two other friends, Carolina Peralta and Excel de la Cruz. We started about maybe coming into a month now, and we started mainly for voices in the Latin community of here in Charlotte. We first started with an organization with Vanessa Guillen, and we're still trying to be involved in other things within our city.
Nice to have you.
Thank you. And it looks like we have a special guest with us, our superstar advocate. Maya, you want to introduce yourself?
Yeah, hi everyone. I'm Maya Wells. I'm a human rights and peace activist. Hey, Emmanuel. And I'm just here to represent our generation and do my best to be part of this conversation. Thank you.
Thank you, everyone. I've been trying to mute my mic because, as I mentioned, I'm actually broadcasting virtual from Key West, Florida, and I'm having some sound issues. If you can hear feedback, it's coming from me, and I apologize. I don't know what it is, but I'm going to try to minimize my speaking, which everyone should be clapping. So I'm Christian Cano, one of your co-hosts. That's wrong. I have a Medicare for All. I have been wearing this endlessly for here in Key West. They were one of the few cities that actually blocked anyone coming into Key West who did not live in Key West, and they did for, I think it was 2 months, somewhere around that time period. When they opened up, they wanted to see how things were going. It's a small island, I think only one hospital, so they're very concerned about making sure they have things under control. The Key West City Council voted that anytime you're outside your house, which means in your yard, anywhere, you must wear a mask and face coverings. And so everyone here is riding around with bikes, motorcycles, on boats. Everyone is wearing face coverings. The bars are closed, but you can sit down at a restaurant, but you have to be an open air restaurant. Very, very strict requirements. So that was the reason we decided to come here to vacation, was because it was one of the strictest. Plus we bought a trailer, so we're in a trailer and we are away from everyone. And so I've been very impressed by how they are taking care of each other. But more importantly, people know they're safe here and they're coming here to spend money safely. And so that is one of the things I think is interesting. So we'll find out how they're doing it here as compared to other places. But what we want to talk about is, oh, I forgot, Jenny.
Yeah, I was about to say.
Thank you, Jenny. Everyone, as we always do on Coffee and Pan Dulce, please salute to your neighbors and salute Coffee and Pan Dulce. Salute. You can see mine. And I do want to say that I still have that concha that I bought at the store in Marathon Island coming down to Key West. And this concha, as we mentioned last week, says it is a French pastry.
That is my favorite concha when I'm on the trip. So I stop at a gas station and get that kind of concha. That's actually French. That's actually
it's a Mexican pastry.
It should be French concha.
Yes. And I also want to thank a company that's here that everyone knows about. It's a grocery store called Publix. They're very, very strict about face coverings and face masks. They're so strict that the Florida-based chain called Winn-Dixie, which is based in Florida, at first they weren't going to require people to wear face coverings and masks. But Publix came out and said there's no reason why we can't do it, and they have signs everywhere in their stores here. And so Winn-Dixie reversed course 2 days ago because they're trying to stay in business. And I want to thank Publix. I have these donut things from a wonderful place called Publix. So I thought I'd make it a little fancier. So let's talk about school. Everyone was hoping that President Trump yesterday, during his first press conference, and since April, I think it was several months, would at least tell the American people what we're going to do to keep our kids safe, or what we're going to do to keep everyone safe. He did not mention schools. He did not mention nursing homes. He did not mention, he mentioned testing, how we needed more testing, but he didn't say how we're going to do it. So I think, I don't know if anyone wants to add to that, but I'm still confused on what our national leadership is doing to help us keep this virus under control. Jenny, I know you have some information about schools, about CMS. Is that right?
Well, they opted, or they voted a few days ago to go to what they call Plan B plus, which in North Carolina they had an A, a B, and a C. The A means full schools, all in-person learning. B was a hybrid, a mix of in-person and virtual, and then C is completely virtual. So B plus means for Mecklenburg or CMS that the first 2 weeks of the school year is completely in person. So 150,000 kids plus 19,000 employees, so 169,000 people total are going to have to be in buildings indoors for the first 2 weeks, 10 days. And that's a drastic change, and it's very different than the other top 20 cities in the United States. So Charlotte, North Carolina is the 15th largest city in the United States. And comparable other cities have done way different plans than we have. We are definitely the oddball in the top 20, including Wake County, which is the largest school district in North Carolina with 160,000 students. They actually are going completely virtual at the beginning of the year and have an option to do in person. I think they're going to revisit it 6 weeks into the school year. So they've opted to go in virtual since it's out of control right now, and they're not sure if they want to mirror what the society's doing versus us. We're just picked arbitrary 2 weeks to go into school.
Jenny, do the parents have the right to keep their child virtual? Plan B.
I believe they can opt out, but all the employees can't. So all 19,000 employees have to go. They've all gotten a memo or an email that has stated that if they are not there for those 2 weeks, it's considered either a resignation or retirement. If they're retirement eligible, obviously they can retire. But if they haven't put enough years in, then it's considered a resignation.
That's my question also as well. What's going to happen if we as parents decide not to send them for the first 2 weeks and decide to go virtual? Are we going to get penalized? Are we going to be called to court? Because I understand that when you miss out of school, three up, 3 down, you're going to court.
Well, and that's the gray area, is that they haven't really said for sure if it's considered truant, but according to the verbiage, and again, this is the problem with the CMS leadership, is they have said you can opt for virtual, you can go to Plan C as a parent, but then the wording of it says the 2 weeks are mandatory. So there's a lot of conflicting language between the state rules that said parents can opt in and out and what the school districts have done. And since the state didn't have a definite plan where they gave the 3 choices and honestly took probably the cowardly role, your local school districts had to come up with their own plan and which direction to go, which that's kind of dangerous too. But yeah, it's been a mess.
Gaston County has something completely different. We're still under the same state, but Gaston County, it's completely different than Union County and Mecklenburg County. So we have three different curriculums now coming up.
All 100 counties, all 100 county school districts in North Carolina can pick their own plans according to the school board. And it's one of the few times that when you look at why they shut down in March when we had a lower amount of cases, why they're putting schools in session with a higher amount of cases than there was. So we shut down CMS schools on March 19th. And then the next day was an in-service teacher day for the 19,000 employees. And then they haven't been in session since then. And why there is a rush, and I'll say one more thing before I turn it over back to Christian, is of the top 20 schools, either the school districts have delayed the opening of the schools past September, so they're not opening until after Labor Day to give them more time to prepare. But every one of them has a virtual option, meaning that they're all going to some virtual distance learning at the beginning of the year, with options to look at in person if the numbers improve in September or usually October. So there is no big city school districts that are opening up universally for a mandatory 2 weeks, but Charlotte. Charlotte's the only one of the top 20 that's come up with that, according
Just
to
heard
research.
California is not going to open at all and wait until next year.
Yeah, San Diego, 80% of the large school or 80% of the school districts in California have shut down until 2021. So LA, San Diego, and San Francisco, 3 of the biggest 7. When Governor Newsom announced that they could have the option to do complete virtual learning, the first 3 were those school districts, which comprise of over 800,000 students. And they immediately went to virtual. They didn't even second guess it. Like LA went to it, and San Diego went on it the same day, the first day they could do it. San Francisco a couple days later, and now over 80% of California's school districts have opted to go virtual with no in-person option at all. And the other 20% are hybrid.
Are you going back to college? How is that coming up? I know we were going to have another girl with Emmanuel. They were going to talk about how do they feel. 1, going back to school. 2, being as Latino, what are we going through? Because they're saying we're the #1 right now in high risk of COVID. It's a lot of mixture going on. How do you feel about going back to school?
I feel so many things. Well, actually, I just graduated from UNC Charlotte this past May, but I am taking a year off just to make sure, thank you, just to make sure, that I know what I want to do, because I do intend to go back to school for graduate school, specifically Master's in Public Administration and Public Policy, but, and it would be online. But my mom, she's a pre-K teacher at a Title I school, Briarwood Elementary, and she has a low immune system. So I am very concerned of how this is all going to roll out. And I just wish that at the federal level, they would mandate masks and for schools to be virtual. They're giving police departments more money, and yet they don't give teachers enough money. And I'm very, very concerned. So many questions. I don't know who to ask. The CMS school board, Betsy DeVos. I'm willing to ask. I'm willing to drive to DC and ask them. But I'm just like everyone else. I'm very concerned, very confused. Why would you put human lives on the line for 2 weeks?
Especially small children.
Why didn't they take our voices? I think we as parents and some of the employees, they didn't step up, or we didn't go up and question a lot of other things. Let's say, for instance, this is the next 2 weeks. Can we have another type of teaching method? Maybe doing them outside on a circle, lower the time from 7 hours to half day, kind of alternate. I mean, they weren't giving us they didn't give us an opportunity to put our input. They only did a survey, what you want and what you think, and that's it. Steve,
so you bring up a good point, and I think the one of the foundational premises of your point is choice and opportunity. You want to be able to choose what's best for yourself and your family. You want to have options to choose from for your education. And, we want to talk about Betsy DeVos or the federal government. Well, good news for everyone in North Carolina. North Carolina handles education, right? The federal government has a minimum number of guidelines. We all want to look to Washington, D.C., which I don't like. That might just be my personal political predilection, but we have the ability to petition our school boards, who are elected officials, if I remember correctly, and the State Department of Education. And I'll tell you, Raleigh is a lot shorter of a drive than Washington, D.C. If you live in Mecklenburg County, for example, talking to your local school board people is a lot easier than getting a hold of Betsy DeVos. And these are the people that make these decisions. So earlier in the conversation, Jenny, you had a lot of really great information. I was just trying to bring it all in. I did have a couple questions. So all these restrictions that you said, you know, and this is true, but this is not, and this information conflicts. Is that only for traditional public schools? Does it include the public charter schools, or is it all schools that have to be located in a building in Charlotte, in North Carolina?
Okay, so private schools, if they're not funded by CMS to where they don't fall under the CMS guidelines, like the day schools and things like that, have nothing to do with that. So they decide their own thing. But if they are under the CMS flag and they report to the school board, yes, then they have to go by those same rules.
I got you. Okay, I was just curious about that. And I've been trying to find, I know I've heard here and there that cases are going up, and on the NCD HHS website, you know, you have laboratory confirmed cases, completed tests, deaths, hospitalization rates, but I can't find any information for what constitutes a case. Which I think is important context. Is it just some guy tested positive and he's like, feels fine? He's like, well, I'll just stay home for 2 weeks so I don't get anyone else sick. Is it someone who has a cough but is otherwise all right? Or is it someone who just like literally can't walk up the stairs because they're going to get out of breath and they're just on the verge of going to the hospital? Do we know if there's a demarcation in what constitutes a case?
Well, there's two numbers that they watch. Here in Mecklenburg County, one of the two big numbers is hospital percentage of positive tests, which year to date has been about 21%. So of all the tests, everybody that tested positive in Mecklenburg County, 21% of those required some sort of hospitalization care. So, and that's been pretty much the norm nationwide. It's hovered between 18 and 22% nationally. So the number within the number, yes, the asymptomatic positive test people, you know, they're counted in that number too. But the scary number is the limited amount of ICU beds versus how many people require that. And so why they're trying to keep the numbers down is if you have 500,000 people test positive, you can almost bet that 20% of them are going to require hospital space. And we only have 173 ICU beds in Mecklenburg County. So you do the math, you know, if it gets out of control.
Yeah, I think that's a great, I think that's a great question. Thank you, Jen.
Not only in Mecklenburg County. I mean, my mother couldn't be attended in Union County because they had less beds than Mecklenburg. So they had to take her to Mecklenburg. I've had friends that were rejected from the hospital because they didn't have any beds and they end up dying. So
that's a very good question that Stephen asked, because I think there is some confusion for people who maybe aren't as engaged as we are here about the numbers, the top number, all of that kind of stuff. And luckily we have Dr. B back. So Dr. B, maybe you can kind of explain to us in a layman's term, or the best you can, is this getting worse or is this getting better?
You know, I'll start out by saying this could not be more confusing. And I'm so happy not to be in a school board position of having to make a decision about the schools, because it's just so complex and there's so many different opinions. As far as the overall thing, is the virus getting worse in the country and in North Carolina and in Mecklenburg County? I think the answer is yes. We certainly don't have control of it. Which number is the number to look for? I don't know that there's a number. I tend to look at number of deaths. And of course, that's a lagging number, following several weeks behind number of confirmed cases and hospitalizations and all that. But the number that I'm looking for to get any sense of relief is if the deaths start coming down, as they did in New York. So all these other numbers, and I try to follow them, but it's so confusing because what's Mecklenburg, what's North Carolina, what's the country, what's the world? And in different parts of the country, you know, you see different levels of growth or plateauing or kind of whatever. So, but overall, yeah, it's getting worse. I'm still very frightened. I'm staying very, very close to home. my son here in town took his boys on a little weekend thing to the beach and came back and said, oh, it's very safe and we were able to distance. So if y'all are getting cabin fever and you feel like you need to go somewhere, I think it'd be safe. I don't need to go anywhere. I still have things that keep me busy. Now, if I were going stir crazy, maybe I'd take that into consideration. But personally, as a physician, as an old person at higher risk, even though I have no associated medical pre-existing conditions, I'm afraid. I'm scared to death. And as long as I don't have to do anything other than go to the grocery store and a quick trip to the farmer's market, we're staying pretty much close to home because I think we're a long ways from this getting under control. So,
do you know if the numbers?
Just a second. Let me have one comment about the school. My understanding, I just tried to interpret it this morning about the CMS thing, is this mandatory 2 weeks, I think, is going to be staged. I think they're going to do it like in thirds. I don't know exactly how they're going to do that, but I don't think it's a matter of every single student and every single teacher and employee coming back simultaneously. Maybe the employees do. That would make sense. But I think the students are going to be staged. So it's not going to be this mass exposure that I think we all have in our minds about that. And that may be the best you can do. I just don't know. I don't have the answer. I'm glad I don't have to have it.
They're doing it a lot like colleges. So I think they're doing an A-B block, I believe.
Something like that, yeah. Mm-hmm.
So I think that was one of their workarounds. But I actually have a question for you, Dr. B. There's been so much emerging information on COVID as far as side effects, long-term effects, and so then is that part of your concern? Why you're afraid of COVID as a physician?
I try to keep things as simple as I can, and I'm afraid of dying. Okay, I'm 73. I don't probably need to worry about anything's going to affect me for 20 years. I worry, am I going to live for the next year or two and not get this and whatever. So that's what I'm looking at is fear of death. Absolutely, that's it. And that's what a lot of the younger people in the country have minimized. But now we're hearing stories about what is this 30-year-old kid in San Antonio that died, and he said, "I think I made a mistake. I didn't take this seriously." So I'm going to try not to make a mistake because I'm taking it very seriously.
Yeah, and I think you highlight something very important, which is, the fear aspect. A lot of people are rightfully and justifiably very worried about this. And I know I go to the CDC website or the North Carolina Department of Health and Human Services website, and I'm looking for information because I want to make the best decisions and choices possible. But the information that is coming out that's available is, at least for me, really sparse. Now, I'll say this, I know a lot more than the average person about epidemiology because I read a lot and I didn't have any friends when I was younger, so I read a lot of books. But there's scant information about the best choices people can make. Like, so for example, you look at the current website, the state numbers, 1,600 people are listed as having died. That's a tragedy especially for their families, right? But I don't know if there's any comorbidities there, if that means that I'm still at risk, if that's something that's is this a disease that really affects people 65 and up? And so that's what you really have to be worried about. Is it somebody if you're overweight or if you are a smoker, what's going on? Who's really at risk and who's not, so we can make the best decisions on our own. Because I don't have any of that information. And I don't know if you guys, if you folks know if you have that kind of information available, if there's a place for it, or if this is just something that we're all dealing with, kind of fumbling in the dark with something we don't really know a whole lot about because information isn't really forthcoming.
Well, here's again, in my interest of trying to keep things as simple as possible, you can get overwhelmed with numbers and information and data in trying to make a decision about it. And so, younger people have kind of, I think, as you suggest, seen, it's mainly the old geezers that are kind of dying and people in nursing homes and people with comorbidities. That's true. But that doesn't mean that no one under the age of 60 is dying. A substantial number are. Your risk is less, but it's not zero. And so, it's well, to what degree are you willing to take a chance? In other words, if I go out and go to a restaurant or lower my guard a little bit, I'm playing Russian roulette. And there's maybe 100 chambers in the cylinder. Okay, so I'm not willing to take a 1 in 100 chance. A younger person is maybe playing it with a gun with 250 to 500 chambers. You're talking death. Are you really willing to play that game when it's so relatively simple to wear the mask and the distance and do all these kind of common sense things? And the other thing is, you might not die. You might have a mild asymptomatic case, but do you have a grandparent? Do you have somebody that you're in contact? Might it kind of go up the chain? And how would you feel about that? So, you know, different people are in different situations. And if you're an essential worker and you kind of have to go or you're going to starve and things like that, people have to kind of bend their situations. But if you don't, if you can work from home, if you can get the children somehow educated, it's not going to be perfect. These are not perfect times. I say just everybody, I think, needs to be as careful as they can. And I really believe, look at the other countries. These other countries have done things we don't want to do, but they've, by and large, kind of controlled this thing, and they're not dying. There was a great report out of Sweden. You know, I talked when I was on here before about how Sweden is doing this real-time laboratory experiment for the world. Sweden chose to kind of keep their economy open while taking some measures to protect the old seniors. And they said, we think that's the best way to go. We realize that we're going to kill more of the old people in nursing homes. We're willing to make that trade-off. Well, not only did they kill a whole lot more people in nursing homes, their economy also suffered just as bad as other countries who took more serious restrictions. So to me, the answer is you better be careful with this and don't use the economy as an excuse to start getting casual about it, because that's not going to solve the problem.
I think we can all, well, maybe not you, Stephen, but I think we can all kind of agree, since we started talking about COVID-19 March, that the questions that Stephen has, and those are questions I understand, those should have all gone away by May. I think by the end of May, every rational, reasonable adult should have come to the conclusion, this is a serious thing. So all of the questions that people have about, are the numbers correct? Are the numbers aren't correct? To me, that is not a reasonable, rational, responsible way of looking at this anymore. That's something kids should have gotten rid of in May. And I don't mean to be harsh, but moving forward, we all have to agree. It's not a mystery. It's not a conspiracy. This is a very serious thing. Ruth's mother was in ICU.
I wasn't believing.
I have family members.
I kept on attacking. I kept on saying things that, you know, going by whatever was moving in the media until I got infected. I got affected. My family got affected. And the worst was my mother almost dying, spending 23 days in ICU. So this is no game. I mean, I don't care how it started. I don't know if it's a pandemic or not. It's reality. Right now, I don't really even care about the numbers. I care about the safety of our community. If I go outside, I got to make sure that my kid, even though I have a 5-year-old grandson, they tell me, no, he's not propensed. He's here right now because his mother is waiting on results and she's pregnant. So she decided to send him over here. I'm going to be doing everything that is on my hands around my community to take care and promote safety from now on. I guess we have to put on someone's shoes in order to understand. And I'm not searching about numbers anymore. I'm searching, again, I say it, about safety.
Chris, if I could say one thing. The encouraging thing for me this morning was they interviewed a reporter. She covered a Trump rally. She was out there in communities. I don't recall exactly where she was from. She caught it and she knows exactly where it came from. So they did contact tracing for her. She got a little better after 2 weeks and then wham, she got it and she was hospitalized. She was scared to death. She's 27 years old. And she said, I have to admit, I was covering this thing and I really wasn't taking it serious. And now I am, and now I'm going to make sure that I get the word out. So Ruth, you know, exactly what you said, until you experience it, some people just don't get it yet. And in my own family, we lost our grandfather. And my 3 nephews were not they were being careless and reckless, Pop died. And now they don't have any grandparents. And that's what it takes to wear a mask and be socially responsible. And I feel sorry for them, but I've been telling them since March, and I feel sorry for people that are like that. But more and more people that are waking up need to be really vocal, and I'm glad to hear
You know, what is wrong by just wearing a mask? I mean, what is it harm? What, I mean, I don't understand what's the rebellious about saying, no, you're not the boss of me. I am doing what you say. Come on, it's just a mask and it's for your own safety.
They don't get it.
The reason I made that statement was basically to say, because we're talking about schools, and the only way we're going to be able to make schools safe or just things in general is we all have to agree on like facts. We have to agree on the base. If we can't even agree that this is a serious virus, then I understand why there is misunderstanding about where we need to move forward with schools. So we all have to start with the base. And the fact that it took President Trump that long to finally say, I'm fine with wearing masks, it's going to get worse before it's better. Maybe we can reset it and let's all move forward as adults. All this conspiracy tin hat stuff, that's stuff we can argue about a year from today or 2 years from today. But at this exact moment, the goal is to keep people safe, to make sure that we can do the best we can in this pandemic. And that's really should be, I mean, would everyone agree that we all have to kind of start at a base to move forward? Because if we can't do that, yeah, good.
To keep it on point, especially since we're talking about seeing schools stay, and for all the parents or possible students in the room, and I'll start with Dr. B. If you had kids that were school age, would you send them to school right now in person?
Yeah, that's very interesting, and I take as a basis for my feeling something that I saw in the news the other night where they interviewed 5 well-established university professor pediatricians who have children. And I think every single one of them said they'd send their kids back. That on balance, all things considered, that the risk of getting it and spreading it in a school with precautions is probably not a whole lot different than if the kids are home and running around and, you know, whatever they do. And so I'm not a pediatrician, but I take that as a pretty encouraging thing that I'd be willing to send my kids to school. Yeah.
Can I go next?
Yeah.
I'm not. I will not send my kid. He's not going back to school. I mean, he's not. Let me tell you why. My grandson, after school was closed back in February, he was invited to a small gathering, less than 10 kids at a bouncy place. He came back home with chicken pox within 2 hours of spending time in that party. So what makes me think that if my son's gonna go 7 hours into school, he might not even, probably he will not get congested or get infected because he already got the virus, which I understand that it could come back to him again, or it can come back to my mother and make it worse. Plus, we're expecting our second wave, which is in fall. What's going to happen with that also? I mean, everybody's just focusing right now, right on August, school starting. What about September, October, November, in the fall time when flu season comes back? Apparently, flus no longer exist. Now it's going to be COVID. I'm not sending my child to school.
Emmanuel?
If I had a kid, I don't think I would. I just feel like it's not safe right now. Me knowing kids, especially at the CMS, me going to CMS, they really don't understand, I guess, the severity of what is going on, and they wouldn't take it serious. And well, for that fact of them being kids, they wouldn't take it serious. And they're not really that much of danger compared to their parents or their grandparents or uncles. So I feel like we kind of have to wait it out and, you know, at least do virtual classing for right now.
Why do you think they're not aware? Are you just not news people, or your parents aren't talking about it? Why do you think your age group is so uninformed? That's what I can't understand.
So I'm talking more of kids that would be in grade school, Of course, I feel like I've seen colleges take their precautions. My mom still goes to CPCC, and they do practice social distancing with masks on. They have small classes, about 5 or 6, but I'm talking more for CMS and smaller kids who, they just don't know what's going on. Because me knowing the kid, being a kid when I think it was H1N1 going around, or it was a swine flu. We didn't really care at the time. We were kids and we were just playing around. But I think that'd be kind of the same thing right now. They wouldn't take it seriously as they need to, even if being informed.
So last night, Emmanuel, we were in our production call. Jenny was giving us an analogy about birthday parties. Jenny, you want to give that analogy real quickly?
Well, I mean, I raised 3 kids. A lot of people don't know that about me, but I actually had a different life before I transitioned. So I was a parent for a long time. I guess I technically still am. But I just know that the birthday parties I've had, these kids are running around. Once you get, if you have the first couple that show up, it's usually pretty chill. But by the time you have 10, 15, 20 kids there, the little yard apes are just running around, licking doorknobs, and they're all blowing out candles. You tell your kid to blow out the candle, but the other 19 kids also slobber all over the cake, which makes me not want to eat the cake. But, schools, the reason why we send kids to school is to educate them. That means that they're not built in with a preset list of instructions in our brain. And one of them is behavior. Operating as a society, they teach us a lot of rules in kindergarten. Like the old poster, it said everything I needed to know about life I learned in kindergarten. Like keeping hands to yourself, social distancing, going by the rules. But we still have to reteach them, because like my middle child, which I raised 2 boys and a girl, and my middle child, I could tell him something on a Wednesday, and I guarantee you by Thursday or Friday, I had to remind him if it was something important, because he could walk in the next room and he's going to focus in on what he wanted to do. That's just the way Todd was or is. And he's still that way as an adult. But I think the most important thing to take away from this is, even if a teacher has half the size of the classroom, say they do an A-B block, you're still talking about, in most cases, 9 to 12 kids in a lot of these classrooms. That's still a lot. And then every classroom is going to have kids in it with suspect air conditioning and HVAC systems. One of the things that I took away from the last night's discussion, because there was a discussion with the CMS board, and people could make 2-minute comments on why they feel for or against going back to school for 2 weeks. And there were primarily educators weighing in and employees of CMS. And almost 90% of them were against it, maybe 95%. And they stated the reasons why. One of them was very, very important. The school that she teaches at, 2 to 3 times a year, the sewage backs up into the school. The air conditioner does not work most days. And now they're going to be expecting people to go into this building that's old, that's run down, and expect this HVAC system to circulate air properly when it doesn't. And many of the other schools have the old school design where there's rooms that are more intake and there's some entire rooms that are more outtake, meaning that the flow of the air is in the architecture is so dated and so inefficient. And CMS has not remodeled those schools in the last few months. So they're going into buildings that already promotes, a lot of sickness anyway. And now we're adding a pandemic on top of that. And I think they're just opening too soon.
Well, one of the questions that we were going to ask today, and everyone, if you can answer this in 15 seconds or less, because if I say 15, maybe you'll stay in 30 seconds. So I don't have a dog in the fight. I don't have any kids. Why should I care about CMS in schools? Who wants to answer that? Because I don't have a kid, so Maya.
Because they're part of your community.
Yeah.
Yeah, I would absolutely agree with that. I mean, children are our future, right? And so we want to give our families as many opportunities and chances to succeed as possible. And part of that is just being able to make the right choice for you and your family. Like, I wouldn't send my kids to public school. It's just me, a personal choice that I make. But I know people, for example, who do send their kid to public school, but they're worried because there are comorbidities involved. Someone has, they're being treated for chemo. It's like, oh, my immune system is already, completely wrecked because of the cancer treatment. Well, yeah, of course, you'd want to keep your kid home because you don't want to take that risk. That's perfectly fine. I know folks who are doing tutoring, right? It's like, now they're tutoring, they have the ability to tutor. Not everyone has that opportunity, but there are, what's the latest information? This thing doesn't spread outdoors. So why not have small classes in an outdoor setting when the weather's nice, and be taught like nature taught us back in the day, right? If it's a sunny, beautiful day out, have people distanced out, and you can have the teacher at the front, maybe a small class of 12. After all, small class sizes are better. These are, things that we can, these are workaround solutions, right? When we just need to be able to have the flexibility to find out what works best for ourselves, for our communities, at our county level. And thankfully, we don't have to go to DC to do the right thing, because those people are such a hot mess. They can't get anything right, if you ask me. But we can call our local school boards. We can say, listen, we elected you, and if you want to be in your position of authority, these are the things we need. And it's so much easier to get a group of concerned parents and community activists together to say, these are the things we think that would make our schools safer, or these are the educational options that our communities want. Do it, because you are servants of the people, right? There's no one, I don't think there's only one, one size fits all solution. And that's fine. We can have a whole bunch of different solutions, and people can leave it up to their own conscientious decision making as to where they think, the risk is. And, that's kind of my thought. Give people as many choices or opportunities, as possible. Like, no one ever is going to go into a restaurant, for example, and say the menu has too many options, right? So having options is good.
Have you ever gone to order a burrito at a place where there's like 800,000 burritos? No, I want just a bean burrito, a beef burrito, and a chicken burrito. Sorry, Stephen.
I'm a taco guy myself.
Okay, all right.
Tacos
Dr. B,
auténticos, por favor.
That's right.
Tres.
Dr. B, you want to add something?
Oh, it's a balance, isn't it? And we can all have our opinions, but there are certain things in society where decisions have to be made, and we can't all kind of have our choices. We can't. Some of us decide to wear seatbelts in an airplane, and some of us not. And some of us decide we want to smoke in a restaurant, and others not. So we have to come to some consensus, and it's great for us all to have opinions. But I'm a scientist, so I'm trained to respect scientists because they're in a better position, I think, to understand all these millions of facts and confusing data points than Archie Bunker or any of us who form an opinion because we feel something. So, bless their hearts. I really would like to believe that at least in CMS, the school board are very dedicated to trying to find the best solution for the most people. They're relying on data from Mandy Cohen, the doctor that heads the HHS over in Raleigh. They're all trying to make the best decisions for everybody. I think they are allowing this option of opting out for the first 2 weeks of in-person kind of thing. So keep your kids at home. That's great. But I think there's merit. My son is in this education system in Colorado. They're doing the same thing. There is merit in having the students eyeball the teachers for the first week or so they know who they are rather than just being on Zoom. And as far as I'm aware, I think that's probably a very sound approach to giving this kind of 2 weeks in and then doing the best you can remotely. But we can't have a million choices. This is not a burrito menu, and we kind of have to do the best we can with the recommendations that I think genuine scientists and concerned school board representatives are coming up with.
Well,
I
don't have a dog in this fight as far as I don't have kids in the school, but I also know that 19,000 of my adult neighbors live here. And if we go by the numbers and by the mortality rates of the state of North Carolina across the board, the average adult mortality rate is about 4% in North Carolina. We have 19,000 teachers. If they get a 2 weeks exposure, there's a high probability that we could have up to 760 CMS employees pass away from this. That's a hell of a number. I don't care who you are. So think about the trauma of these kids losing their favorite teacher because they all went back to school. Yeah. That's a real harsh reality. And just to bum rush it into August, like, why can't we wait a little longer to even start school, virtual or in person? Why can't we push it back to Labor Day like Dallas, Texas did? They pushed their starting date till after Labor Day. San Francisco, their opening date back. So a lot of school districts are whether it's virtual or in person, has pushed their number back from August to September just to give themselves more time, that if they ever going to look at an option of doing in person, it gives them time to adjust their buildings, put in the 95% filters, do all the things, the due diligence they need, that they need that time. But they're not even, CMS has not even considered that an option to push the starting date back, which I think time, one of the reasons we wear the mask is to slow down the spread, but to get scientists time to maybe come up with a possible vaccine or a workaround with this. Why aren't we giving our employees, our 19,000 neighbors, time and giving them that courtesy and human dignity?
So I wonder what would happen if all parents that think this the way I'm thinking, not sending their kids to school, will not show up, even though they're gonna divide their stuff. How will the school district I guess they would have to kind of see it to believe it. Because I mean, I'm calling on a strike. I mean, if I need to get with other parents not to send their kids on that day, I'm gonna do it. You know, I have a middle schooler. They have different periods. How they're gonna be sanitized moving from one class to another? How they're gonna adjust that? What about the parents that can't afford to go and take their kids to school and pick them up? Buses, how are we gonna adjust that? Our bus drivers, we're gonna put them in danger with our own kids? Come on, I mean, if we didn't do it at the beginning and we closed down right in February just because we didn't know what was going on, we're still debriefing, we're still experiencing, we're still learning from this pandemic. So we're not a pro yet. Why not wait till next year and let's start fresh?
Mass civil disobedience is always an option. We know that when large amounts of people decide not to follow the edicts of the government, there's nothing they can do. I mean, earlier on during the first lockdown, you had some conservative groups here and there like, no, we will open and see or whatever, right?
Because they don't like their kids. They want teachers to raise their kids.
Let me make my point for a second. So these were small groups of so these are small groups of protests, and the government came in and they made some arrests and all that. A few months later, when hundreds of thousands of Americans were in the streets marching for injustice and police reform, the government didn't do anything because scale matters. So if all these parents say, you know what, we're going to keep our kids at home, there's literally nothing CMS can do.
You must have been watching the very different marches and protests, Stephen, because the protests that I saw, the You're Not the Boss of Me protests, these were people with loaded guns at state buildings and the police did nothing. I was at 5 very peaceful protest marches wearing my face mask and CPD gassed people. So you live in a different reality than I live in, or you're cherry picking the reality.
I mean, did you go to the George Floyd Justice Walk like I did? The Kids Fed Up March put on by the NAACP, any number of the protests? Yeah, I did. I went to the same ones. They were peaceful. They were great. There are lots of people there, and
that's the reason the government didn't do anything.
Yeah, the cops didn't do anything. Yeah,
because they were peaceful. The other ones were not peaceful.
Which ones?
The other ones were not peaceful. The people with the guns were not peaceful.
I mean, I don't know which one you're talking about.
Okay. The reason I'm interrupting you, because I don't want you to throw in secretly that somehow the
No, it's about scale.
March for protest.
The,
Yes.
the number of people,
yes.
and those are two examples where you had small groups and large groups. It's the only one I could think of. But scale really does matter.
Yeah,
like, and that's the only point I really want to make. So if you have like one parent here and there who keeps their kids home, someone's going to show up at your door and be like, hey, you know, a truancy officer is going to talk to you. But if you have hundreds or thousands, the truancy officer is going to throw up their hands and be like, all right, whatever. You know, there's safety in numbers. That's the only point I'm trying to make.
I'm just wondering is that if all the CMS employees just don't show up, all 19,000 of them just say, we're going to do a sit-in, we're just going to stay home.
Yeah.
What does CMS do now? They're going to have to punt, pass, or kick. I mean, like I do agree with Stephen from the fact that I think organized protests, especially ones that are massive, where they're unified in their thought process, which Reopen NC and all the Reopen groups and Black Lives Matter movement had that in common. They were both well organized and well oiled. We can debate the reaction of the government, you know, on a different show, but to keep it on point, to Stephen's point, the Reopen groups in the 3 states that were the battleground states, they were very effective because it was a small group, but a big enough group, and it got enough media attention that a ton of states reopened way earlier than they intended to because of that political and very public pressure. And I think where this really needs to be affected is the CMS employees need to say, you know what? Several of them are unionized. I'll sit home, and they can't fire at all.
Hey, Jenny, we're running out of time. Maya, you want to jump in real quickly?
Maya wanted to say something, and Jenny, Maya. After Maya, can you read what Philip Cano just mentioned down in Texas, what's going on? Okay. Thank you.
Maya.
Yeah. No, I was just going to say, like, I mean, are these CMS school board members, are they meeting in person via Zoom? Like, what does that tell you?
Jenny, you want to touch that in 15 seconds, please, about the hypocrisy?
Great question.
Demand more.
Go ahead.
It is pretty delicious that last night's meeting was a virtual meeting, and they're asking their entire staff that they are in charge of. Now, I will say to CMS's board's defense, the meeting before that, where this got debated, it was in person. There was about 40 people in attendance, including the board members. So they've not done all their meetings virtual, but the one that was very important last night, and I think it's because there were so many people that wanted to speak, they were afraid that the majority of the 19,000 employees were going to show up to it, probably out of fear, is that last night's meeting was virtual. And I think some of it was because of efficiency and another, because it went on for hours. I watched an hour of testimony, and it was not slowing down. It was just like a Gatling gun of people getting up and wanting to go way past their 2 minutes, kind of like on the show. But I think Philip said several things, which I appreciate his input, is that I would not send my kids because of the high school students that carry a shield around from class to class, but that does not make me feel any better. The kids here start back August 13th. And updated today, campuses are closed here till September 27th, if I understand this right. And so some Texas districts are finally understanding. And I know Dallas is waiting till after Labor Day. Dallas ISD, I think they ruled on it last week or the week before, the superintendent and the school board did.
Sorry, Jen, but we got to wrap up here. But listen, it's so great to have Stephen back. And so it is, Stephen, we got to have you back.
My pleasure.
No, listen. One of the reasons, and you know this.
He's our new substitute.
No, seriously. One of the reasons we started this show, and I forget quite often, and I appreciate you humbling me. One of the reasons we started this show was because we wanted to sit around at a table as neighbors with different points of view. And we wanted not just to hear me and Jenny's view or me and Ruth's view or Barbara's or all of our views, because we agree pretty much 75% of the time, most of the time. But it was great to have you because it makes us, especially since we're being quarantined right now, or some of us are, it's good. I don't often get different opinions and different views, and to hear how different people are coming in. And that's why we miss Jeff, and that's why we miss you, and we miss all the other people who are on our show who maybe have different points of view as we do, because we need all of that perspective. Because I do know that one thing we can all agree on this panel is that Betsy Ross is the worst Secretary of Defense, Secretary of Education. I don't know, can we all agree with that?
And yeah, get rid of the Federal Department of
Betsy
Education,
DeVos?
100%.
I don't know about that, but still. Okay.
But yeah,
listen,
no, we agree on that, yeah.
Yeah, we're going to wrap up, and I want to thank everyone for joining us so much. And I do want to tell very briefly, we were going to have a writer for the Miami Herald on to tell us about a social justice situation that happened in Key West last week. There was a parasailing captain who ran adventure tours for parasailing, and he had posted last week on his company, I believe, Facebook page or whatever, about African Americans here in Charlotte Charlotte and Key West, saying that the only thing they're good for is accepting government checks, and then use the N-word. Well, within prompt justice, members of the community here in Key West, and their motto is one human place, I believe is their motto here. They were going to arrange a protest at the pier, A&B Pier, a famous pier here, where they anchor their boats. And within very quickly, days, they were kicked out of that pier. It is impacting their businesses. The person has not apologized. The captain still has not apologized for this, but the community here reacted so quickly, and they said, we're not having any of this in Key West, Florida. And so I was so impressed and proud on how quickly that happened here. Charlotte being ground zero for so many things, we can look to the community here in Key West and see how quickly, and to Stephen's point, how quickly protests can make when you're talking about the dollars of the people here in Key West. So I want to thank Key West for doing things like that. They've always been a very progressive island, or a southernmost point. So thank you so much, Key West, for what you do and you lead. Also, I was here in Key West in 1990 something, where the pride flag reached from the Atlantic Ocean to the Pacific Ocean. It was the world's largest flag, and they still have that pictures of all of that here on Duval Street. And so it has always been a very progressive. And there was an article in the Washington Post talking about when Key West opens up, the gays will save Key West again. All I got to say is, all right, so tell us where you're going to be. I want to thank everyone thanks, Stephen. Thank you so much for joining us. I'm sorry if I gave you a little bit of a hard time, but
No. I love the discourse. The most important thing is
discourse.
Yeah, I mean, we can disagree on something, but we can disagree peacefully. We're all Americans here. It's all good.
Yeah. Well, all right. So let's go around. Tell us where you're going to be. Who wants to start? I think if we're looking at it, Stephen first, Dr. B, Jenny, Barbara, Mama Ruth, Emmanuel, and Maya. So let's go ahead.
So I'm just going to be hanging out at home, social distancing and all that. I don't want to get sick. I got sick back in January and I didn't like it. So I'm, going to not do that again. But running a campaign from home is a little difficult. We're doing the best we can. You can, if you're interested in my viewpoints, or you just want to reach out and engage in discourse and dialogue, you can go to stephenfornorthcarolina.com. That's Stephen with a V for northcarolina.com. You can also check me out on social media at Steve4Gov. So at Steve4Gov on both Twitter, Instagram, and Facebook. Thank you.
I'm going to be holed up in my lovely apartment with 5-minute trips to the farmer's market and the grocery store no more often than once a week, keeping my fingers crossed and trying to learn about the world during the process. So,
well, I possibly will be doing 2 queers in a truck. I don't know if we decided that or not, but we'll talk off air. And then this weekend,
we can talk about Stephen.
Charlotte virtual Pride begins. So we have all kinds of events. Just go to our Facebook page or our website, see how you can get involved. And it's not too late if you want to make a video and be part of the experience, whether it's the virtual Pride Parade or the day of Pride. There's several opportunities for civic organizations or businesses to show the Pride spirit here in Charlotte.
Barbara, you're mute. You're
Can't hear
mute.
you.
I'm going to be staying at home because my garage is under construction and they've extended it 3 more days. So that's where I'm going to be. Nothing else. Ruth?
Okay, I'll be wearing my, I guess, less expensive rag. So there's no excuse. If you ain't got no money, you can still wear a mask out of a t-shirt. Double layer though. I look cute, don't I? Now I'm just gonna be here at home working with occupational therapists and physical therapists for my mom and just taking care of my family, wishing everyone not to be out there getting sick. I also want to say thank you to Emmanuel. I know he's kind of shy. It's his first time being on our show. He didn't know what to expect. Emmanuel, thank you for the courage. Thank you for being those kind of new teams in the city that are showing pride of who they are. And keep it up. You're always welcome. Bring your other team in. And we would love to hear more about what y'all are doing here in Charlotte as young kids. Next.
Yeah, definitely for now, we're just gonna, there's gonna be a Vanessa Guillen event this Friday, July 24th, where we will be remembering her. That's about it. Other than that, just going to that, safely social distancing, wearing a mask, and, remembering that there's still things going on in the world while this pandemic is going on. But yeah, that will be happening.
Maya?
So I will be hanging out with a few good friends, just me and 2 of them outside, and I'll be going to a People's Platform this Friday in downtown, and I most likely will be speaking there. We'll see, but yeah, that's it.
I want to shout out to Maya. Thank you for coming last Wednesday for the Vanessa Guillen vigil candlelight. It was a pleasure to see you. Thank you for reaching out. And you're not that type of young people that might know us through social media. And then if we see each other on person, you kind of avoid. You came up and gave me a hug, and I was happy to see you. Thank you, Maya.
So what you're saying is she wasn't the typical Latina teenager that when they see you, they act like they don't know you?
You know how we roll sometimes, yes.
Exactly. Listen, everyone, thank you so much. I very rarely give President Trump credit, but I will say that yesterday was probably the most normal I have ever seen him at a press conference. And I don't mean to say that to be facetious. I meant to say, if you did not know all the buffoonery before, he looked kind of presidential. What he said was a little bit, he went off a little bit, but I think that's the secret to him. Keep it 27 minutes. Don't let him ramble on, which he's never going to do. But so I do want to thank him for saying, please wear a mask. Maybe other people who follow him will start wearing mask and face coverings.
We just gotta send him a message to understand that he's not gonna be here for the next 10 years, so he can't interfere with our census.
Okay. Yes. And
tell him he reads well. Sorry, sorry.
Words are hard. Hey, listen, I do have a question. I know we got to leave, but I have a question because Jenny said this yesterday at the production call. Dr. B, is there something about standing next to people more than 15 minutes?
Yeah, I have heard that, imagine this is almost kind of like you have a perfume on you. And if you kind of walk by somebody on a sidewalk, you might not even notice it. And if you spend a couple seconds with them, you'll notice it. And if you spend 15 seconds with them, you'll really notice it. So yeah, the longer the exposure to somebody who has the virus, the more virus particles you're going to get into your mouth and nose and things like that. So yeah, time does matter. And that's the main thinking behind concern about being closed up in rooms with poor ventilation with a lot of people so that the virus can just kind of float around and give more opportunities. And that's why it's safer to be outdoors.
You know, that's something
Brevity
very
is good.
important. I never thought about it. And now that I realize how I got infected with the virus was I was trying to keep my social distance. You know how everybody says 6 feet apart. I was thinking by being 6 feet apart, I didn't have to wear a mask because I'm away from them. Well, I don't recall hugging or being next to someone, and I still got infected for not wearing the mask.
It's multifactorial. It's not just one little thing that's going to save you here.
So gatherings above 10 people, if you're, there's a couple things in play when you're indoors, and I'll keep this really quick, is that when you have 10 or more, like in a restaurant or a bar, being sedentary longer than 15 minutes, which you're typically going to do in a bar and a restaurant, that's not your friend. So what's happening in the thermodynamics of an HVAC system is that COVID is blowing around, plus you're touching things too. So it's a twofold thing. Plus we're bringing our hand to our face when we're eating or drinking. All these dynamics contribute to spreading it in an indoor setting. So that's one of the reasons, like if you cough or you sneeze or you just talk or you're chewing or swallowing, you're sending aerosols out. So it's landing all over the place. Whereas if you do al fresco, outdoor dining, you have the natural breeze, you have the open air, you have the UV sunlight if it's daytime. So there's a huge dynamic when you put 10 or more people indoors. That's why grocery stores aren't as dangerous as a bar, for example, because you're always moving in a grocery store, kind of like a shark, you're circling.
Yeah.
Yep.
Well, I think that was very important information because I had heard that before and Jenny brought it up yesterday. And I do know that's why when I do my weekly grocery shopping, I try to stand in one place. I try to keep moving and get out. And so I think that was very interesting when you, okay, all right. Well, we were supposed to leave. All right, everyone, please say goodbye. We're going to stop us on Facebook. Please stay on Zoom so I can thank you personally. So we're going to stop. Thank you very much. See you next week.